This is Steve Hoffert, pharmacist and owner of Magnolia Pharmacy.
This is Megan Garza, pharmacist resident at Magnolia Pharmacy. Today's presentation is on a functional approach to ADHD and autism. We hope you enjoy. Presentation today, but this topic itself, just a functional approach to ADHD and autism, it's something patients walk into the door very consistently asking for help on, whether it's because there are drug shortages out there have to be interruptions in therapy. So what are some natural things at home that we can do to help bridge that gap? And really and truly our philosophy here, we want to provide a personalized approach to care. And so our conversation always goes down the functional approach to both of these disorders. So we'll go ahead and get started. I first want to know who is in the audience, just to give a brief overview of what we'll be going through today. But so this first piece, we're first going to go into just an introduction when it comes to ADHD. And since the majority of y'all are caregivers, patients, yourself, or even healthcare professionals, I'm not going to go into the nitty gritty of these conditions. I more so just want to present just the startling statistics when it comes to the prevalence in the United States and how over time we're on this uphill climb. And so putting that all into perspective. And so CDC and a couple other large organizations, for a long time, they've been tracking this data. 6 million children between the years 2016 to 2019. And you can see kind of dispersed throughout different age groups what that looks like. But we're on an upward climb. And you can see it's kind of depicted there in that graph, the direction that we're going at. And so the intent of this presentation, of course, is kind of just to instill those lifestyle habits and things that we can not only help to affect your life, your loved one's life in this lifetime, but also future generations along the line. The little things that we do, the things that we're exposed to, can influence generational health. So keep all of this in mind. It shows you there what that can look like over years. So when it comes to diagnosis with the ADHD, of course, you have the three types or three presentations. And so you have that more so inattentive type behaviors that can be predominant, or you can have the hyperactive or impulsive type behaviors that can be predominant, or a patient can, for the most part, have a combination of the two. There isn't one that predominates the other. And these are very fluid. And so one year it may look one way, and then life happens, and different behaviors can then take over. Always constantly fluid with this diagnosis. Part on the bottom is really insightful. It shows just how common ADHD can be associated with other sort of mental health. And so behavior and conduct issues, very, very prevalent, as you can see. But then other things like anxiety, depression, they can coexist with ADHD. And so keeping that in mind, as well as of course, autism spectrum disorder and others. And so that's the reason why we've kind of grouped these two conditions, ADHD and the autism spectrum disorder, together into a presentation, because more often than not, they can coexist with each other. Now to briefly describe that prevalence for autism spectrum disorder. So this one's the one that's a little bit more alarming, just because if you see those 10-year increments, so from 2000, 1 in 150 children received this diagnosis. 10 years later, 1 in 68. Another 10 years in 2020, the data is showing 1 in 36 children. And I can only imagine what that's going to look like in 2030. And so very, very important issue that we're wanting, like I said, influence generations. And so it all starts with you, what we're doing in our current lifestyle and how we can influence those around us to stop this decline. And then here, I just have an info and a graphic on kind of what the DSM-5 goes ahead and categorizes that spectrum as. And so the more milder side of that spectrum, you have the Asperger's syndrome. In that middle, you have the pervasive developmental disorder that's not otherwise specified, essentially meaning it doesn't really fall into any of the other categories or diagnoses. And then you have the farther end of the spectrum where the symptoms are much more severe, and that's the autistic disorder end of that spectrum there. So just to give you a visual to paint that there. So The CDC is really amazing. They've invested millions and millions of dollars in researching these conditions, specifically autism spectrum disorder, and just the things that we can do, every single person can do to help detect early, to act early, and to make real differences. And so I wanted to talk about what that monitoring or screening can look like. And these are things that not just caregivers, patients, healthcare providers should know about, but every single person. And so I encourage you all, take this information, spread the word about it, because it's really important. It affects every single individual on this planet. So when it comes to the developmental monitoring, this is something that every single person in a family can do, whether it be a parent, a guardian, any type of caregiver. But this is at home. What are the milestones that a child is reaching from birth throughout infancy, adolescence? So looking at that at home, what that looks like, celebrating the progress. Maybe it gives you the awareness to identify things, take that back to your doctor, have those important conversations early on so that interventions can be made, lifestyle changes can be made. And the CDC, like I said, is awesome. They've provided different checklists that people can use, access for free. There's even an app nowadays for people who are tech savvy, wanting to help track milestones to be sure that their children are not experiencing these developmental delays. And so on the other side of things, you have the more formal evaluation or the screening that occurs by a healthcare provider. Even teachers play a really big role in this one, in this evaluation process. They're looking at the same thing. They just have more validated type lists that they're looking at each point. So at 9, 18, 30 months, they're looking at just general developmental screening. And then should they identify anything, they're also looking at 18 and 24 months, a more specific autism screening as well. And again, this is just to help bridge that awareness, identify things that need to be addressed earlier rather than later. It's really hard for the brain to unlearn things. And so the earlier that we can start, the better. This is something that I found really interesting. So like I said, CDC's been investing in the research for a long time now. They still to this day have projects in the works, but this study to explore early development, or the SEED project, numerous publications, and what they're looking at is how do we paint that picture? What influences this prevalence that's on the rise? And they looked at different things that had some pretty strong association. And so when you look at this list, keep in mind, it needs to dictate how we go forward with our lives, every single one of us. So maternal psychiatric conditions during pregnancy had a strong association with the autism spectrum disorder diagnosis. If the mother during pregnancy was severely obese, also had a correlation there. Any sort of infection during that second trimester that was accompanied by a fever, also associated. Exposure to air pollution. This is a really big one when it comes to environmental toxins, and specifically during certain periods. So late prenatal and then early postnatal, those exposures to pollutants had a correlation as well. Living in any sort of deprivation of high poverty, also associated with this. This one was interesting, hypertension during pregnancy. So this is something fairly common for pregnant women. So something to stay on top of. Prescription opioids just before beginning pregnancy. Opioids, so things like codeine, hydromorphone, things for pain, essentially narcotic pain medications. Other things to consider too. So if the mother had a history of any sort of eczema, psoriasis, yes, so any sort of skin condition, this was also linked, which is really interesting, even the asthma. And so, a lot of these have those immune mediating factors to it. And so that'll come into play as we continue on with the presentation as well. Even birth spacing, they looked at that. So shorter periods between birth and then longer or extended periods as well. They also looked at, and then infertility. So I know PCOS is on the rise as well. And that in particular was also a risk factor for autism spectrum disorder. So things to think about. This is the makeup of our nation, and so how can we change lifestyle across the board?
Megan, one question came in. What about, would you find any risk factors related to paternal issues causing issues with?
Yeah, absolutely. And so when you think about it, prior to conception, the life that a female has, a life that a men have, when it comes time to conceive, both of their lives influence then the life of that child that's been conceived. So as far as specifics, when you think about just the different pollutants that you can be exposed to, even alcohol, smoking, things like that, those different social behaviors, these are all things you need to think about, not only for your own health, but like I said, it's all generational. So what are you going to be passing on? All things to consider.
The question was brought up live about vaccines.
Yeah, so vaccines has always been a controversial topic as well. I think, though, when it comes to autism in particular, there is no nail on the head of this is the one reason why every single child is diagnosed with autism. It's a multitude of factors, and it can be a little different for everybody. The vaccine may put a child at susceptibility for certain genes to then take over, and so it's a big controversial topic. Big as pharmacists on vaccine safety, so conversation worth having. But to this day, there aren't any direct ties. But when you have inflammation, your immune system then come into play, and you know that's already susceptible, certainly something to consider. I just wanted to touch on conventional treatment. We're not here to talk about this part of things today, but there are certain things that as pharmacists, we play a big role in. And so those are the ones that are bolded on the bottom. I did want to touch on the importance of behavioral therapy, though. It's so important. As pharmacists, if we can prevent you from being on the medication, that's what we want. So utilize these types of services and resources. And especially when it comes to children less than 6 years old, we don't want to put them on medications. So what can we do? And oftentimes that is direct parent training. And I don't want people to take that as an insult. We're not, saying that you're not raising your child correctly and you are the reason for these manifestations. That's not it at all. It's just, how do we create some sort of consistency and routine in this child's life to be able to help them, create a nurturing environment for them to heal, for the family to heal. It's a whole family dynamic. So taking that approach, especially with younger children, is important, but throughout anybody's life, even adults need to have that same mentality with those around them. So it doesn't really come into play with medications until greater than 6 years old. There's numerous medications now. Of course, the stimulants are the ones that work really rapidly. They got a whole slew of side effects. And then there are the non-stimulant class that don't work as quickly, have their own set of side effects to consider. So for a lot of patients, it's what works for you and what doesn't, trial and error, and no child is the same. And so as pharmacists, I will say the drug shortage issue when it came to the stimulants was something that came up. And for us, a lot of patients immediately were like, well, what can we do right now? Is there something more natural? I don't want my child to have to start taking a stimulant. There are growth concerns, weight things that come about. So definitely a conversation, like I said, we're having quite often. But that complementary and alternative space is where we really love to hone in on, just because it gets down to the diet. So what does nutrition look like? What are some things over the counter that may be able to help supplement the diet that we're not able to get? And then different other practices like mindfulness and relaxation, things that we don't even think about but are so essential, even for children. And so being that influence, guiding patients and families through this process, that's a space that we like to try to reach for. Just to talk a little bit more about that treatment piece. So 62% of ADHD patients are on a medication. It provides a breakdown there. So about 3 out of 4 in the US are actually treated. There are a handful that opt for medication alone. unfortunately, that's the first thing some will reach towards, so they won't even try the behavioral. And that's really important, like I'd mentioned. So a combination of the two is probably the best thing that you can do if a medication is needed. As pharmacists, of course, biggest thing is even though we don't want you to have to take the medication, sometimes it's necessary. And so how do we guide you through that process, keep you on the lowest dose possible? How do we manage side effects appropriately? That's what we're here for, to be a resource for y'all. So with that being said, though, I also want to note that there's a percentage of the population where children are untreated. And I think it can go down to, there is a stigma. And some patients, or their parents for the matter, may be in denial. They don't want to have to go there. They don't want to put their child on a stimulant, so maybe things will just work itself out. But like I said, being the more proactive, taking the more proactive approach to things is going to be really important, because I said it's a family dynamic. And so kind of getting that out of the bubble, creating that safe space for families to be able to talk about this is important. And then I want to touch on the treatment when it comes to autism spectrum disorder. So there is a couple of different components when it comes to the developmental delays, the behavioral issues. There are therapists who work really closely, even one to target some of these things, whether it be a functional occupational type issue, maybe it's a speech issue that they can work directly on. Maybe it's helping in the learning environment. So how can we go ahead and facilitate those types of things? But they're all important. It takes a team when it comes to this, with everything really. And so having everybody be on the same page, communicating with each other. I included there a logo for Success in the Spectrum. If you don't know, they've opened here in the Magnolia Landmark building, just next door to the pharmacy. Excellent resource when it comes to any sort of therapeutic services in the behavioral, occupational speech space there. And then, so when it comes to kind of more of our territory as pharmacists, the pharmacologic avenue, the healthcare system is broken. A lot of the medications get slapped on and they're covering symptoms, not getting at the root of things. They come with a whole other slew of side effects. And that's not fun at all. It's not conducive. We're not fixing anything. And unfortunately, at the end of the day, it ends up being a business for somebody. And that's not what we're about. And so really trying to bring awareness to these issues. Of course, there is a need for some of these pharmacologic agents to be on board to help manage things really quickly. But if we have any say in things, we want people to go ahead, pay attention to your diet, pay attention to your lifestyle. There are different types of therapies out there. There's a beautiful thing called the human-animal companionship and the therapy that animals can provide for us. So exploring different routes there. And again, those mindfulness and relaxation practices across age, super, super important. So all things considered, as pharmacists, really, we're wanting to be a resource for y'all. We are accessible at the end of the day. And so if it's something that we can't help directly, we want to be able to connect you with the right people. So to jump into some of the root causes. How many of y'all have heard about the gut-brain axis? Yes? Okay, so this is something that for years and years and years they've been exploring. And it's something that right now, especially in the functional space, they're shining a lot of light on. And so if you didn't know, the gut and the brain are in constant communication. There are pathways back and forth. So many different factors can influence this, but they are directly connected. You have nerves that are going direct, the vagal nerve in particular, that innervates your GI tract. And you can see so many different things are at play here. So your immune system comes into play that can develop those cytokines that can be inflammatory, wreak a lot of havoc. And then you have your endocrine system. So think about the hormones that our body needs. The gut helps produce those, as well as some of our neurotransmitters. And so when we think about all of these things, the way that our body functions and everything that we need, if our gut and our brain need to work to produce these, then it needs to be optimal and there can't be any sort of disruption. Because guess what? If there's disruption in one, it's shared. There's a constant line of communication that goes back and forth. So if there's inflammation at play in the gut, there's going to be neuroinflammation in the brain. If there are things, for example, a leaky gut is something that can occur. Essentially, that lining, little gaps start to form, things start to get out. Your immune system is now on fire, essentially. And a leaky gut can then translate into a leaky brain. So things are getting to places that they shouldn't be. So keeping this clean is really, really important, shining light on it. It's something that you may have heard for the first time today. It may be something you're not, but it's not something that's completely understood. Lots and lots of research coming out about this all the time, the different correlations, what's going on. But the more and more that you put yourself out there to learn about these things, the better that we can understand. But what we do know right now is the connection exists, and we need to help with especially that dysbiosis, the inflammation that can go on, and fix that so that we can clean up this communication that's going on. And when I say continue to learn, there are so many resources out there. Dr. Mayer is a really great doctor who has published some books. Even James Greenblatt, big one in the space of ADHD, that explore these different avenues of the gut-brain axis and how it can influence mood, immunity, and so many other things. Another is Kenneth Bach. A couple different resources if you are a reader or want to become a reader. Definitely books you should check out just to get a better understanding. And I will say, if this is something that you're really want to get into and maybe you haven't found the right provider that can do these things for you, having a good solid foundation yourself and taking that back to them, having resources that you can refer to other people is important. So different things to keep in mind there, different resources. We have the next Slido question. So this is, for a moment, just humor me. This one's just for fun. Kind of like a 2 truths, 1 lie. So pick out the one that's false. We're hoping with the connection that it'll work. If not, wasn't meant to be. Oh, there you go. It wasn't meant to be. All right. So which one is false? I'll read you these 3 statements. So you have between 250 and 1,000 times more bacteria in your gut than there are stars in the Milky Way galaxy. Next one is the brain contains 400 times more serotonin and 500 times more melatonin than your gut. Last one is if you stretched out the tissue in the gut on a flat surface, it would cover half a tennis court. So which one do you think is false? Yes, only one is false.
House divided so far. Oh, here we go. By the way, while things are coming in, many of you have asked questions in the question and answers online, and I've answered the majority of them. If there's any that we haven't answered, I'll make sure we cover at the end, but a lot of your questions have been answered online already.
All right, we'll go ahead and close off the poll. Y'all are geniuses. So this first one is false, and the reason for that is the gut actually contains 400 times more serotonin and 500 times more melatonin than the brain. And so I just wanted to put these out there to show you how vast this system is and how important the communication between your gut and your brain are. It's actually coined the second brain. And so think about how important that is, and why we're talking about these things when it comes to any sort of mental health condition. Thank y'all for humoring me there. Okay, so back to the gut-brain axis and more in the context of autism. So like I mentioned, that vagal nerve is the pathway that directly connects your nervous system and your gastrointestinal tract. And so there are different things that come into play. You have your diet, you can have bad bugs or pathogens that can exist in your gut microbiome that wreak havoc, and then inflammation. And so you can go from a normal gut to dysbiosis or a disrupted microbiome. That, like I mentioned, is going to send those bad signals where you don't want them. So you're going to get that leaky gut. So where things are able to pass through the gut lining, it's increasing things like inflammation. You have different metabolites escaping. Your production of these important neurotransmitters like GABA, serotonin, everything is getting affected, goes back to the brain. And then what happens is our body then sends stress signals and all of our hormones are off. So it's all interconnected. And this is really the basis of what we're getting at when it comes to why the gut is so important. And one of the top 3 supplements I'll mention is a probiotic to get that microbiome right. So you don't have this constant cycle of inflammation and stress that are wreaking havoc. It also goes into things like diet and pathogens that we need to address if we want to get this right. So multifactorial, an image there for y'all to digest. Lots of research, like I mentioned. And so not only the gut brain, but like I said, looking at that microbiota or the microbiome and the influence that these different species can play. They've done extensive research and found that in autistic patients, there are certain strains that are more present than and how that can directly tie into inflammation, a disruption in the neurotransmitter production, just metabolism of certain things, endotoxins that can be at play. The reason why a lot of these manifestations when it comes to behavior and mood exist because of this dysbiosis. Now, to talk more directly about those imbalances. So we've touched on that dysbiosis, and so things that can come into play are like frequent antibiotic use. Patient has a constant strep infection, they're unable to get constant ear infection, constantly exposed to different trials of antibiotics. Your assist at the counter when you pick up an antibiotic prescription should always be telling you to cover the yeast-based probiotic to help protect what can happen on the gut when an antibiotic is taken. Studies show that just one round of antibiotics can wreak havoc for up to a year. And so if we're not doing what needs to be done when antibiotics are needed, like I said, those effects can be long-term and they can cause a whole slew of issues. The other thing that can occur when it comes to dysbiosis, things that a stool test might expose is the yeast overgrowth or candida. They can see that. If that's present, they can go ahead and treat that with an antifungal. And sometimes that's all a patient needs to have some sort of clearance. Next one is digestion. We've talked about nutrition. Oftentimes digestion is disrupted. Things in the common American diet like dairy, processed foods, gluten, a whole different combination of things that make the American diet what it is, just lead us all in a downward spiral. And so unfortunately, that's the root of a lot of things, that nutrition aspect, and the fact that the American diet there is not putting us at our best foot forward, because that causes inflammation. If we're not digesting the nutrients that we need from the foods that we're eating, and can be an issue directly in the gut. Things can be drug induced. So if you're on a particular medication that needs to be on board, it can be depleting certain nutrients that you wouldn't even know about. So like I said, keeping this line of communication open with your healthcare providers is really important so you can identify these things. Other things to consider, so food sensitivities or even intolerances, this can be tested for. So some people walk away accepting that they have GI upset, not even knowing that there's a food sensitivity in their diet that they didn't know about, that they could clear up and live a healthier, better life. So something to keep in mind there. The other thing we've mentioned is the inflammation component of thing, that permeability or that leaky gut, leaky brain that can happen to keep this constant cycle of stress and inflammation going. Last thing I wanted to mention was detoxification. So some patients will have genetic polymorphism where they're not able to methylate, not able to clear things like heavy metals that can build up in the body. So we're not able to excrete those, and that's a problem. So functional medicine practitioners will do heavy metal toxicity tests, things for like lead, mercury, to see if that's a factor at play. And sometimes a chelation agent or just detoxification protocol can certainly help there. Other thing that I wanted to mention was mitochondrial dysfunction. Mitochondria, they're the powerhouse of the cell. So all of that energy that your cells are needing to operate, if you have dysfunction there, well, that translates into your tissues, your organs, your whole body systems, and you're at a great disadvantage. And so getting to that root of the mitochondria in the cells is really important. And it's something we'll touch on towards the end of the presentation further.
You said sometimes if an antifungal was necessary. What type of test did you ask for you to get it then?
So the question in the room was just on the type of test that needs to be done to figure out whether yeast overgrowth is an issue. And so that a stool test can be done. They'll actually characterize what's growing, what sort of microbiome they're working with. Should there be a candida overgrowth, then they can go ahead, prescribe the appropriate antifungal medication to try to wipe that out. Did you want to add on anything specific about that, Steve?
On the testing? No, I mean, that's the key. You really got to find a practitioner who takes a personalized medicine approach that looks at root cause. And that's really what it comes down to. Like Meg said, the traditional medical system's kind of broken. We just put Band-Aids on things. And you're right, so many of these are root cause. And that's why you've got to find, there are functional medicine GI doctors. That's what they do. They look at, and I'll just say, like Megan said, especially on the GI side, that's typically the root cause or like a hotbed of where things start. It's not the only thing, but it's a big thing. And so, yeah, that the testing aspect, if you find a good practitioner, they can really do a world of good in finding the root cause of what the problem is.
Yeah, and like you touched on, so there can be specialists in the functional space. So a GI specialist, there are even psychiatrists where you can work directly with them that work in this functional realm. And so we'll talk about directories later on where you can try to access providers in your area. So now to dive deeper into that functional approach, we just brought up the concept of testing. And so here you have different types of tests, not comprehensive or all-inclusive whatsoever, but definitely things to address some of the concerns that were brought up just previously when we discussed root causes. So cellular micronutrient testing, this can be done with a blood draw. There are kits that we have here in our pharmacy. They are able to either pick up, get to a lab location where they're able to do the blood draw, send it off. It'll actually generate a report directly from the company. Cell Science is the company that we currently use. And as pharmacists, we're able to sit down with you and really look at what sort of nutrients your body is lacking and how can we tailor the supplements that are taken, tailor the diet that is eaten to help fix those gaps. The other thing that's really neat about Cell Science, they actually have another assay. Well, they'll test for antioxidant protection. So antioxidants are super important in your diet. They help relieve a lot of that oxidative stress that can just wreak havoc everywhere. And so doing this assay will help to determine which sort of antioxidants do you need to increase in your diet to have the most benefit. And so as I skip through, you'll see an image pop up. This is the micronutrient assay. It'll tell us if there's any sort of borderline, severely insufficient or sufficiency when it comes to a number of different vitamins and nutrients. Next one here is that antioxidant protection assay that I just explained as well. So the other thing to consider, and I touched on this, is that heavy metal toxicity. There are tests that can be done for that. ZRT, we do partner with them to offer that testing here. Again, the company will go ahead, generate that report for us, and you're able to keep this. We can speak to you about it. You're also able to collaborate with your providers, and they can collaborate with us on what's the best approach to help with a detoxification protocol if needed. There are other things to consider. Again, hormones are another thing at play, whether that be a thyroid panel that's needed or your sex hormones like your estrogen, progesterone, testosterone. Keeping all of this in perfectly fine tune is hard, and everybody's off a little bit, but knowing exactly what your issues are at that time and how can we go about doing the right things to get you balanced. A stool test, we talked about that. When it comes to looking at the microbiome, sequencing to see what's present, what sort of pathogen concerns we may have, and how we can fix those. Different food sensitivity testing is available to actually see what sort of IgE markers are present, so that true allergic reaction. So if that IgE is flowing through patient's system, we know there's something on board that they're allergic to, we need to address. And so a food sensitivity test will help identify those so we can do a full elimination. And more often than not, a patient has a lot of success from that. Another thing is just different sort of inflammatory markers that we may look at. We know everybody is constantly inflamed, but it's just something else if you're really wanting to get a full panel and help drive a lot of these things away. How many of y'all heard of Mark Hyman? Yeah, so he's awesome. He's been in the game for many, many years. A lot of like the other authors and the books that I showed previously, they were talking about the gut-brain axis and cleaning up the gut to help with different sort of mood and mental disorders. Gosh, years ago, before it was even cool. Now everybody wants a piece of it, but they were talking about it years and years ago. And so he wrote this book a while back, 7 strategies, and the Ultramind solution. But these 7 strategies, if you listen to his podcast, it's another great resource. If you don't like to read, listen to functional medicine practitioners on different podcasts. He's got 7 strategies just to address broken brains, specifically talking about ADHD, but these concepts, like I said, they're going to help when it comes to any sort of mental health disorder. So eating those real whole foods is really important. And these are things you can start today with the choices that you're making. So eating those real whole foods, removing any sort of food sensitivities. And so like I mentioned, things like gluten and casein wreak havoc. And so eliminating gluten and eliminating casein, which is a milk protein, so dairy products. Sometimes a patient will just go on a 6-week trial of a full elimination of gluten and dairy products and see what that does. And more often than not, they find at least some benefit. And so something to consider. Like I said, it's kind of a lot of those drivers when it comes to the inflammation and stress and the leaky gut, all things considered there. So removing those sensitivities that can occur, addressing nutrient deficiencies. So this is something that everybody can be a little different depending on what their diet looks like, depending on what digestion looks like. And so that's why the testing is really important to help tailor. We don't want patients to be on 20 different supplements over the counter. We want them to use food as medicine if at all possible. So go with that, but also the importance of truly identifying the specific nutrients, and the ones that are directly tied to autism are like B6 is really important. Zinc is really important. Magnesium. And so sometimes a simple multivitamin can be all a child needs to have some improvement. So like I said, another reason why having these open conversations is really, really important, because sometimes there can be easy fixes, things that you can do today just to get started. We talked about the gut, so fixing the gut's going to be so important when it comes to addressing broken brains, inflammation components. So doing or eating an anti-inflammatory diet. There are supplements that we'll talk about briefly that you can take to help address this. We talked about antioxidants, the power of that in detoxification, ridding our oxidative stress that drives a lot of the inflammation, and really detoxifying. We live in a world where there's a lot of environmental pollution, a lot of different, for example, like pesticides that we can be exposed to that wreak a lot of havoc. So just detoxification is really an important concept that needs to be explored. So I mentioned supplements. These are the top 3 in my opinion. So fish oil, and this is one that, gosh, I wish everybody could do a fish oil. But really the main driver there is inflammation, and there are options for children. There are some people, they just don't like taking these very large capsules. But the benefit that they can provide if you're able to get through that uncomfortable moment of swallowing these you really want to be in the range of 2 to 4 fish oil or your omega-3s daily. Like I mentioned, the importance of a multivitamin and how that one simple thing can be a difference for some people. Mito Complete Multi or MitoCore is the one that we always recommend. I mentioned methylation issues, so this can also come into play when it comes to absorbing certain nutrients, and we're not able to activate them if we have genetic polymorphisms at play. So when you have products on your shelf that are readily absorbable because they are methylated versions, for example, things like folate, they're able to work in their body. Our body doesn't have to prepare it in order for its use. And so these are things to consider why we prefer certain products over the other, because they have nutrients that are methylated already readily absorbable. And there are, of course, children's chewable options for multis that we carry here as well. Last thing, we've been talking about the gut, so a probiotic. So many different probiotics on the shelf. With this one, you can have a range of the amount. And so the CFU, or the colony forming units, the amount of actual live organisms in these products, it can vary. On the larger end, you have Visbiome products, which we constantly recommend, but there is such a thing as too much, and you can have GI distress if you go too far up that scale. And so kind of starting in the middle is a good thing to do when it comes to the amount of live microorganisms within a product. And we have products that are low, middle, and like I said, on the higher end, like a Visbiome product.
So another question. There are many strains. Sometimes you can have probiotics with up to 60 strains.
Absolutely.
Would you say the more strains, the better?
Not necessarily. So the question was just on how different products available have different types of strains, different concentrations. Is it more strains the better? I don't think so. So there's a lot of research out there on what particular strains are the best at certain things. So for example, when it comes to the gut microbiome, the strains that are really good that have shown in research to help, especially in this space, are Bifidobacterium, Lactobacillus. But in those are a whole slew of species. And it's important to think about all the different microbiomes that exist in your body. And so we actually have a women's probiotic that we formulated with a physician in the area, and research backed on this very specific strains that thrive, that work well at helping to improve the health of the vaginal microbiome. And so there's a rhyme and reason to these things. So why they'll pick certain strains to be in certain products. So not necessarily the quantity of strains there, but what are they correlated with? There are certain strains that are useful for certain things. And so when you're looking at all of the probiotics on the shelf, that's something that we are constantly checking for, and that you can do as well, for sure. Any other questions when it comes to these products? I will say too, one of the things that we recommend is a rotation. So the biggest thing is you're supplementing the microbiome, but you want to build diversity. You don't want the same bad bugs to be bullying the others, so to speak. And so that constant diversity by rotating a probiotic, let's say every 3 months or so, allowing different strains to be introduced to thrive and then continue to go on that process. Like I said, it's just boosting diversity. The reason why we're using probiotics is to help do that. And so it has a lot of benefit there.
One of the things too, I think about, this is just kind of a common sense things. Like she mentioned, certain strains have certain things. We talked about how important the gut is in terms of our overall ability to have good mental health. There's a particular bacteria that's you can find in some of their products called Lactobacillus reuteri. And one of the challenges, especially with many children who are on the autism spectrum, is their ability to have like a bonding or develop relationships. But what's really kind of cool is Lactobacillus reuteri actually increases something in the body called oxytocin. So that one particular strain, in my mind, if I had a child that was on the autism spectrum, I would look at possibly getting, and there actually are certain ones, it's not found in a lot of probiotics, there's been a lot of data to show that patients who have a lot of Lactobacillus reuteri, or you add that to the gut, make more oxytocin. And so that's something to consider in terms of like that one. that it's a good probiotic in rotation, but that one might be really, really good for a child on the autism spectrum.
Next thing I wanted to just briefly touch on, we talked about mindfulness and relaxation as a form of therapy. So that vagal nerve, or that vagus nerve that directly communicates your nervous system to your GI tract, there are things that you can do to help improve the tone or just help activate and support this line of communication. So this is really hard. We live in a world where we're constantly go, 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 go. And we never really think about these things, but simple things like singing and humming and laughter have a calming effect for a reason. And so these are exercises that, whether they're intentional or not, incorporate them into your lifestyle. Things like cold exposure, so like splashing your face with cold water. Things like cold plunge have gotten really popular recently. And then deep breathing. And so that diaphragmatic type breathing where you're really feeling it in your belly, your exhales are much longer than your inhales. All of that has a very impressive calming effect on the body. So again, these are simple things that you can start today with, but just wanted to kind of put those out there as another consideration. And then of course, exercise and movement. These are so big, and you wonder why, that rise in endorphins and the calming effects that can occur. People talk about like a runner's high. Some people, they dread running, but you get to a point where after a while you're with this vagus nerve, everything's just calm. And you have to go through the flow of things, though. It's not going to be immediate. You can't be sitting breathing for 30 seconds and think that's going to work. Really, it's that practice of mindfulness. And this is why meditation is so big in a lot of cultures, because of this reason and the benefit that it can have on the communication between the gut and the brain, and how that influences your neurotransmitters and your hormones and everything else. And so there's a reason for everything. It's a reason why people say laughter is medicine too. Alrighty, other things to consider. I wanted to briefly touch on this. So compounded methylene blue is something that's been more of one of the novel compounds that pharmacies are getting into. But there are books written about this. Steve's got an awesome video on our YouTube channel that you should definitely check out, just on the clinical applications of methylene blue. I will say there's some people that mention this too, and they're like, what? And so just learn more about it. I know, Steve, you've got pharmacies that who are doing a whole lot of this in this space, isn't it right?
Yeah, it's just really kind of shown on the scene. We talked about mitochondria and mitochondria importance, how much it drives a lot of these processes. And methylene blue is actually the oldest developed drug. It was one of the first developed drugs we ever had, developed for something else. But through the years, we've learned it actually low, very safe doses. It actually works to support mitochondria function. So that's the autism side. And then what's even more important is it actually supports some of the neurotransmitters in the brain. And that's more that ADHD type side, or ADD. And so it kind of works on multifaceted. Back during the Adderall shortage, I had some of my pharmacy buddies that looked at possibly working with practitioners to try this as an alternative. And we heard some good results. Don't want to overpromise anything or make any claims, but it's something to consider in terms of a therapy that may be beneficial.
And like I said, if you want to learn more, there's an awesome YouTube channel that we have called Magnolia Pharmacy, and Steve's been putting a lot of great content out there. So just another resource to have. The next one I wanted to touch on was compounded low-dose naltrexone. Lots of great literature about this. This is something that Steve also has a YouTube video on. You're welcome to watch that as well. But this one's more so targeting a lot of the inflammation, the immune modulation that's needed in a lot of these patients. These books have been written out there, and as you can see, used in autoimmune disease, cancer, depression, autism, even things like Lyme disease or dermatologic conditions. It's kind of become the catch-all, but has a lot of benefit for a lot of different conditions. Naltrexone at the commercially available standard doses is 50 to 100. When we talk about low dose, we're talking about like below 4.5. Even sometimes they do ultra low dose. And so like I said, a space that's been researched for quite some time. I think back in the 80s, it was first kind of looked at when it came to AIDS and HIV patients, then into multiple sclerosis, pain syndromes, and a couple other things. And so there's a resource called the LDN Research Trust. You can go on their website. They've got providers all over the nation, or the world for that matter, that are looking into this, putting funds into researching this medication for all of the different indications. And so another option to consider. I'm sorry? So this one, when it comes to the low dose naltrexone, the one that we are constantly educating patients about, there are vivid dreams. And this is something that simply changing the time of administration during the day can help eliminate. Other things that can occur, don't occur in everybody's, like headache, a little bit of GI upset. But like I mentioned, we're using this in very low doses. There's a titration schedule that needs to occur. So very close relationship with the healthcare provider who's prescribing this. We go very slowly and titrate up on that dose to find just the right spot where you're feeling better with your symptom picture. So your dose may be different from the next person. And so this is one of those therapies that requires a really good collaboration with not only your compounding pharmacist, but your healthcare provider, and the loop needs to close. And so with all three, keeping that intact. So there's one really big one that we always look out for, narcotic pain medications, or those opioids, because this medication here, the commercially available standard dose of naltrexone is used for opioid addiction and alcoholism. So it works on the same receptor, but it contradicts its action. So it blocks as opposed to stimulating that receptor site. And so if a patient is on any sort of narcotic pain medication, then takes a low dose naltrexone, their pain medication might not work because they're competing for the same receptor sites. And so we always want to keep that in mind. Any other questions? Okay. Lastly, just a few action items. I've talked about this, learning as much as possible, whether that be through reading, meeting people, having conversations, listening to podcasts while you're on your drive home. Learn as much as you can. There is so much that has to be learned even by researchers out there, and they're constantly working to find answers. And so just staying up to date is something that as pharmacists we do, but it's really awesome to see patients and caregivers take that initiative as well. And then they come back and we have some really cool conversations about what was the latest read and whatnot. So if you're able to make some time in your day to just stimulate your brain by learning something new. Other things, like I mentioned, so starting with the small things, starting today, whether that's breath work, whether that's being a little bit more intentional about how laughter is medicine, maybe we should laugh some more. Things like exercise, incorporating a healthier diet. So things that you can do now. Don't do everything all at once. That's overwhelming, and very easily you will just give up on everything. And so one thing at a time, if you're able to, small incorporations. A lot of these things that we're talking about, you need to find a functional medicine practitioner to get access to these testing and any sort of protocol when it comes to treatment. I mentioned a couple of the tests that we offer here, but if any sort of prescription is required as pharmacists, we're needing to work with your healthcare provider in order to get you some of the therapies. Some things are available over the counter. Some of the things a nutritionist who specializes in nutrition can go ahead and, of course, kind of fill in the gaps that you're needing on a personalized approach when it comes to nutrient deficiencies. There are a couple different directories that I listed here from organizations, but I recommend if you're really wanting to dive into this space, there are functional psychiatrists that you can connect with. I looked myself on on one of these directories. I believe it was the American Psychiatry Association. There's also Psychiatry Redefined. They have an entire fellowship program built out for psychiatrists, and you can partner with them and work directly. You know exactly what sort of curriculum they've gone through because it's fully published, and they take all of these same approaches. And so collaborating with somebody like that you'll work with them for a while, but they produce long-term effects, long-term success. And again, it's success that will affect generations to come. So something to consider here is, of course, insurance and the coverage and what that looks like. And more often than not, these testing, unfortunately, they're high dollar and they're most of the time not covered. And so costs and the burden of that can certainly put a strain on things. But some of these, they can be done one time and you can completely change a lifestyle. And from there on out, it's an investment in yourself and your loved ones. So something to keep in mind. Last two, just connecting with local resources. I mentioned Success on the Spectrum as an awesome resource when it comes to behavioral therapy here in the Magnolia community. And like I mentioned, they're a national franchise. And so throughout the Houston area and other states, they also exist. But local resources like that are huge. And other communities out there, whether that be a community of caregivers, caring for yourself as a caregiver is really important. You can't expect to take care of other people if you're not taking care of yourself. And so tapping into that, building a sense of community is really important. And then just simply taking time for yourself goes back to you can't take care of other people if you don't take care of yourself. And so really prioritizing that me time and setting yourself up for success so that you can be there for those that you love within your family. And these are things that you can do now. At this point, I want to thank all of y'all for tuning in online, for being here in person. Thank you for bearing the storm for us. We can open it up to questions.
Can you get LDN without a prescription? It requires a prescription from a doctor.
Require a prescription.
Yeah. What about neurofeedback for ADHD?
How so?
It says, what about neurofeedback for ADHD?
So I probably need a little bit more context to know what direction I'm going at there.
Referral for functional medicine practitioners. That's something if you'll call our pharmacy and you can either ask for Megan or Steve. Either one of us would be more than glad to give you that information as far as that goes. Gut health is the ultimate root of where everything happens. And sadly, the one thing we do to our guts every day is we put food in it. And those two things hand in hand drive so much. I'm not going to say it's the only thing, but if there's any one thing we working with patients have seen the most benefit the fastest is fixing and cleaning up somebody's gut. So just keep that in mind. I mean, that's the ultimate root of things. I know it may be one of the hardest things people have to do, and that's change lifestyle and diet, but it can be the most impactful thing. So
I thank y'all for your participation when it came to the Slido. And these are some awesome ideas for some future presentations, deep diving into this one and getting into others. So I thank y'all for that. We hope to continue providing these educational opportunities to patients. So the more interaction that you can give us, the better, so that we're on the right track at getting y'all the information that y'all need. But thank y'all for being here today again, and thank you for your time.
thank you so much. Have a great day.